If you're over 60 and masturbating the same way you did decades ago, you might be unknowingly causing serious damage to your penis and overall health. I've seen men enter my clinic, proud of their consistent routines, only to be devastated when they discover those habits are why their erections have weakened, their sensation has faded, and their confidence has crumbled. What they believed was safe was silently leading to lasting harm, sometimes irreversible. I'm Dr. James Carter, a urologist and men's health specialist with over 25 years of experience performing penile surgeries, counseling thousands of older men, and helping them restore their sexual function, dignity, and joy. Masturbation can be a healthy, natural part of life, but after 60, your body changes dramatically. Your penile skin thins, blood vessels become fragile, nerves lose resilience, and your prostate becomes more sensitive. Habits that once felt fine can now cause injury, inflammation, or dysfunction, affecting not just your sexual health, but your emotional well-being and quality of life. In this video, I'll reveal 5 critical masturbation mistakes older men make and share practical, judgment-free steps to reverse damage, enhance sensation, and build a healthier, more connected relationship with your body. The 5th mistake is so subtle, yet so widespread, it might completely reshape how you think about self-pleasure. Before we start, if you're committed to protecting your sexual vitality as you age, please subscribe and turn on notifications for science-backed advice tailored for men over 60. In the comments, type 1 if this resonates, or 0 if it doesn't. I'm listening and here to improve. Let's dive into the first mistake, one I see almost daily in my practice. Mistake 1, using excessive pressure, the death grip. I've had countless men in their 60s and 70s sit in my office, visibly distressed because their erections are less firm or their pleasure feels muted. When I ask about their masturbation habits, one issue emerges time and again: excessive pressure, known as the death grip. This is when you squeeze too tightly or stroke too aggressively, often to achieve a quick release. It's a habit many men develop over decades, but after 60, it's a dangerous one that can cause lasting harm. As you age, your penile skin becomes thinner, blood vessels more delicate, and sensory nerves more prone to damage. A tight grip can restrict blood flow, create microtears in the skin, and impair nerve pathways essential for pleasure and erection. Over time, this can lead to reduced sensitivity, weaker erections, or even Peyronie's disease, where scarring causes painful curvature. A 2021 study in the Journal of Sexual Medicine links repetitive penile trauma to chronic dysfunction in older men. I treated a 68-year-old patient who didn't realize his forceful technique was why he felt less during intimacy. After adopting a gentler approach, he regained sensation and confidence within 3 months, saying, "I feel like I got my body back." To avoid this, use a light, relaxed grip and slow your rhythm. Always apply a water-based lubricant to minimize friction and protect delicate tissue. Pay attention to your body's signals. If you feel strain or discomfort, you're doing too much. This isn't just about pleasure. It's about preserving your penis's health for years to come. One patient told me, "If I'd known this sooner, I could have avoided years of frustration." You can start making this change today, but the next mistake is just as critical and targets a vital organ you can't see. Mistake 2, masturbating without lubrication. A 73-year-old patient once came to me, deeply concerned. For decades, he'd masturbated without lubricant, and now he faced persistent irritation, a rougher penile texture, and discomfort that made him fear a serious condition. He assumed it was just aging, but it was preventable damage from dry masturbation. This habit might seem harmless, especially if it's your lifelong norm, but after 60, it's one of the easiest ways to injure your penis without realizing it. Your penile skin becomes more delicate with age, losing elasticity and healing more slowly. Dry friction causes microabrasions, inflammation, and scarring, which can reduce sensitivity, limit tissue flexibility, and make erections harder to sustain. In severe cases, it can lead to hardened tissue patches that alter texture or function, sometimes requiring medical intervention. A 2020 study in sexual medicine highlights how friction-related damage accelerates penile aging. I've seen men develop chronic discomfort or diminished sensation, all because they skipped lubrication. A 70-year-old patient who started using lubricant said, "It's like night and day. I'm comfortable and feel more alive." The solution is straightforward. Use a lubricant every time. Water-based lubricants are safe and effective for most. Silicone-based options are great for longer sessions. Avoid with silicone toys. Apply generously to reduce friction, protect skin, and support blood flow, which naturally declines with age. Make lubrication a non-negotiable habit, like brushing your teeth. This small change can safeguard your penis, enhance pleasure, and prevent painful complications. If this is resonating, comment 1 below to let me know you're with me. Now, let's explore a mistake that can quietly harm an internal organ critical to your health. Mistake 3. Ignoring prostate signals after masturbation. One of the most overlooked dangers I see isn't visible, it's deep inside, in your prostate. I've had men in their late 60s and 70s visit my clinic with troubling symptoms, a dull pelvic ache, pressure behind the scrotum, or a burning sensation after climax. Some feel their bladder isn't emptying fully or experience urinary hesitancy. They often dismiss these as getting old, but they're signs of an irritated or inflamed prostate, frequently linked to how they masturbate. Your prostate, a small gland, produces seminal fluid and supports erectile function. After 60, it's more sensitive and prone to swelling, especially if you masturbate too frequently, too forcefully, or without allowing recovery time. Repeated ejaculation without rest can congest the prostate, leading to chronic inflammation, prostatitis, which causes discomfort, urinary problems, and weaker erections. A 2019 study in Urology associates excessive sexual activity without recovery with prostatitis in older men. I treated a 66-year-old who ignored pelvic discomfort for years, only to learn it was prostatitis from overzealous masturbation. After spacing out sessions and resting, his symptoms improved significantly. Listen to your body. If you feel pain, pressure, or burning after climax, it's a warning. Limit sessions to every 2-3 days, stay hydrated, and urinate after masturbation to clear the urethra and reduce irritation. If symptoms persist, see a urologist promptly. Early action can prevent chronic issues. Masturbation should enhance your health, not stress your body. The next mistake shifts from physical to neurological, affecting how your brain processes pleasure. Mistake 4. Over-Reliance on high-stimulation pornography. I've heard this too often. "Doc, I'm fine alone, but with my partner, nothing happens." Many older men don't realize their brain, not their body, is the issue, rewired by frequent use of high-stimulation pornography. This isn't about judgment, it's about science. After 60, Your brain remains adaptable, but is more vulnerable to overstimulation. Constant exposure to fast-paced, exaggerated porn can condition your brain to rely on artificial arousal, making real-life intimacy solo or with a partner feel dull, stressful, or unattainable. Porn floods your brain with dopamine, creating a reward loop that's hard to break. Over time, this can reduce your response to natural touch or emotional connection, weaken erection quality, and disrupt oxytocin, the hormone that fosters bonding. A 2022 study in Psychology of Addictive Behaviors links excessive porn use to ED and reduced sexual satisfaction in older men. I had a 71-year-old patient who relied on porn daily. After a month-long break and a focus on sensation-based masturbation, he felt more present with his spouse, saying, "I didn't know how disconnected I was." To reverse this, take a porn break. Start with 7 days, then aim for 30. Masturbate using touch, breath, or imagination to rekindle natural arousal. Practice mindfulness. Focus on physical sensations rather than external stimuli. This rewires your brain for grounded pleasure, enhancing intimacy and satisfaction. It's challenging but transformative, as one patient noted, "I feel like I'm experiencing pleasure for the first time in years." The final mistake is less about what you do and more about how you think about masturbation. Mistake 5. Treating masturbation as a chore instead of a health practice. Many men over 60 view masturbation as a quick fix-away to relieve stress, fall asleep, or just get it done without much thought. On the surface, this seems harmless, but treating it like a mindless habit can disconnect you from your body and undermine its health. After 60, masturbation isn't just about pleasure. It's a health practice that supports blood flow, nerve function, prostate health, and emotional well-being. When you rush through it mechanically, you miss critical feedback from your body, increasing the risk of harm and diminishing the emotional benefits. I've had patients describe masturbating out of habit, with no intention or awareness, only to notice reduced pleasure, emotional numbness, or even performance anxiety over time. A 2023 study in Archives of Sexual Behavior suggests that mindful sexual activity enhances sexual satisfaction and mental health in older adults. I worked with a 69-year-old who treated masturbation like a task. After adopting a mindful approach, he reported feeling more relaxed, connected, and fulfilled, saying, "It's like I'm honoring my body now." Approach masturbation with care. Set aside a calm, private space. Use lubrication. Breathe deeply, and focus on sensation rather than speed. Treat it as a moment of self-care, like exercise or meditation. This mindset reduces physical strain, enhances pleasure, and helps you tune into early signs of discomfort or change. By making it intentional, you protect your body and deepen your connection to yourself. Overcoming shame and cultural barriers. For many men over 60, masturbation carries a heavy stigma. Cultural, religious, or generational beliefs may have taught you it's shameful, sinful, or something to outgrow. I've had patients say, "I was told this is wrong," or "I'm too old to think about this." But your sexual health is as vital as your heart or mind. Pleasure and connection are human, not age-restricted. Shame can prevent you from making healthy changes, but you deserve to feel whole and vibrant. If you're hesitant, start small. Try using lubricant or spacing out sessions to build comfort. If porn feels like a crutch, replace it with mindful touch for a week. If you're unsure about safety, consult a urologist. especially if you have conditions like heart disease or prostate issues. You're not alone. Millions of men face these challenges, and taking action is a sign of strength. One patient told me, "I spent years feeling guilty, but now I see this as caring for myself." Reframe masturbation as a health practice and let go of outdated taboos. Conclusion: your body, your future, your choice. Thank you for joining me in this honest, science-backed conversation. If you're over 60, how you masturbate matters more than ever. Using excessive pressure damages nerves and blood flow. Skipping lubrication injures delicate skin. Ignoring prostate signals risks inflammation and dysfunction. Overusing porn rewires your brain, distancing you from real intimacy. Treating masturbation as a chore disconnects you from your body's needs. These mistakes can steal your sensation, confidence, and joy, but you have the power to stop them. My 30 years as a urologist have shown me that men in their 60s, 70s, and 80s can transform their sexual health with mindful, intentional changes. I've seen patients go from despair to pride, rediscovering pleasure and intimacy they thought were lost. A 70-year-old patient shared, "I feel like a man again, and my partner sees the difference." You're not broken, and it's never too late. Start today. Use a lighter grip with lubricant, rest your prostate, take a porn break, and approach masturbation with care. In my next video, I'll share a 5-minute daily routine to boost penile health and vitality for seniors, plus tips to enhance intimacy. Comment 1 if you're ready to take charge, or 0 if this doesn't resonate. I'm listening. Let's make your next chapter vibrant, confident, and unapologetically yours.